and welcome to Rio de Janeiro for this special edition of Inside the Americas. Brazil is the country that has been most affected by COVID-19 in Latin America. Usually, this bright sun would attract thousands of beachgoers, but as you can see, the famous Copacabana beach is empty. Dozens of police officers are patrolling the shoreline in order to prohibit access. Stay-at-home orders have been issued in Rio de Janeiro, as in most parts of Brazil, and wearing a mask is obligatory. However, not everyone agrees. President Jair Bolsonaro is strongly against quarantine orders. He's more concerned with the economy and getting people back to work. In recent weeks, his supporters have been holding protests against what they call quarantine dictatorships imposed by local governments. The war against coronavirus in Brazil has become highly political.
Precisamos trabalhar. O país está quebrado. Está usando a doença, o coronavírus, na política.
Going back to work means greater risk of contamination for Brazil's poorest population, many of whom live in favelas like this one. We're here in Rocinha, which is Rio's largest favela. We're going to look at one of the most important factors in combating COVID-19, which is mass testing. The Brazilian Health Ministry said that they would deliver 46 million tests, but so far they've only been able to deliver 2.5 million. Laura de Mays, Fanny Lotter, and Luis Rolé bring you this report. In the heights of the favela of Rocinha over the last several weeks, from 8 a.m. onwards, the waiting room of this small private clinic is always full. These nurses are testing 30 people a day for COVID-19. At this clinic, they practice PCR testing using mucous membranes, as well as blood tests. Elsewhere, this would cost around 50 euros. But here, thanks to a partnership with the NGO Rocinha Without Corona, it's free for residents of the favela, like Raimundo. This domestic worker, along with all his family members, have come down with COVID-19 symptoms. About 1/4 of people tested at this clinic test positive for coronavirus. This is a grim situation, according to Dr. Tiago Vieira. There's a risk that it will only get worse due to the lack of testing.
Eu já perdi a conta. É muito desafiante, porque aqui não tem como as pessoas fazerem um isolamento social direito, né? São muitas pessoas morando num cômodo pequeno, apertado, sem ventilação. Até mesmo o teste que a gente faz aqui, que é a sorologia, que é um teste muito mais eficaz, a gente teve uma restrição no nosso volume de atendimento.
Is that because it's too expensive?
Não porque é caro, porque está faltando reagente.
The reactive agent is imported from abroad and is becoming increasingly rare in Brazil. Since mid-February, this laboratory at the Federal University of Rio has been working hard to create a new large-scale test using this protein.
A gente está começando esse cultivo hoje. É a primeira vez que a gente produz essa proteína em uma maior escala.
The protein reveals the antibodies present in the blood of people with the virus. It's easy to reproduce on a large scale, and above all, it's 4 times cheaper than the tests that are currently being used. For Professor Almika Tanuri, this discovery is crucial.
Se der tudo certo, a gente pode fazer teste nesse formato. Ó. Então, ó, você consegue ver se você tem IgG ou IgM. Já foi infectada no Brasil, está muito subestimado. Alguns trabalhos na USP de São Paulo mostram de 10 a 20 vezes subestimado. A gente acha que pode ser até mais.
This laboratory's engineering team has also developed an emergency ventilator that is easier to use and is about 10 times cheaper to produce. They hope their work will help Brazil with the country's imminent peak of COVID-19 cases. understand the consequences of COVID-19 in Brazil, we're here with Professor Goná Azevedo. She's an epidemiologist and the president of the Brazilian Association of Collective Health. Good morning, Professor.
Bom dia.
Could you explain to us which populations are most at risk in Brazil?
The way this epidemic has grown and spread, unfortunately, it's most affected people who live in favelas. They're at the greatest risk. Beyond the fact that they need to work to sustain themselves and their families, they need to have the conditions that allow them to stay at home. They need more social support, in addition to needing access to water, soap. We need to address these needs in order to lower transmission rates. This is the biggest challenge for Brazil, for transmission not to happen so fast that there's high numbers of hospitalizations. Our health system might not be able to handle it. We're already getting to this point. There's not enough hospital beds to attend to more serious cases.
Estamos chegando a esse ponto. Falta de leitos para atender os casos que estão em situação mais grave.
And what do you think of the leaders who are talking about relaxing the quarantine measures?
At this moment, it's totally unjustifiable. Right now, we still need these measures in place, and we need them to be even stricter because the epidemic is growing. The number of cases is increasing, and they're increasing precisely in the places where we have the least ability to guarantee control and lower the transmission rates. It's absurd. There's a double message being told to the population. So right now, it's time for social distancing.
Definitely. Thank you very much. If Brazil has the most cases of COVID-19 in South America, Ecuador has the most cases per capita. This small country has been fighting the virus with very few resources. The city of Guayaquil has been traumatized. There have been so many deaths there that authorities have lost count. Take a look at this story reported from Guayaquil.
Maoli Plaza is in the last month of her pregnancy. Where there might usually be nervous excitement, there's only fear. She's tested positive for the coronavirus.
Me da miedo que al dar a luz ella se infecte, no sé.
She lives with her husband and mother-in-law in a poor neighborhood in Guayaquil, one of the worst hit places in Latin America. The port city, home to almost 3 million people, accounts for at least half of Ecuador's cases, and the city's mortality rate for March and April is staggeringly high compared to normal. Health services have been overwhelmed for much of this time. Hospital staff and people with other critical illnesses have been falling victim as well.
Por la falta de recursos por parte del Ministerio de Salud Pública y del Ministerio de Finanzas, no hemos podido adquirir no solamente los implementos de bioseguridad básicos para afrontar la pandemia del coronavirus, sino también los insumos necesarios para las diálisis para nuestros pacientes.
At first, funeral services couldn't keep up with demand, and hundreds of bodies accumulated on the streets. Others were inside the family home for longer than 2 days before they were collected. Authorities have since deployed freezer trucks to clear the city of bodies, but this solution has many locals worried they'll never find out where their loved one lies.
Next, we head to Mexico, where the country has increased the health risk alert level after several weeks of initially relaxed regulations. Many indigenous people in Mexico are part of the high-risk group, and some villages there have gone as far as to completely shut themselves off from the outside world as a protective measure. Laurence Cubillier and Mathieu Coman bring you this report from Mexico.
Welcome to Mexico City's Central de Abastos, where restaurants from all over the capital source their produce. Of course, most people are wearing face masks, but goods, coins and friendly gestures are shared, as always, amongst the 350,000 daily visitors.
No ha habido nadie, ni un caso. Estamos como en distancias, trabajan y como se van rápido, no es tanto que esté junta la gente.
Mexico City is the epicenter of COVID-19 infections in the country, with more than 300 deaths, serving as a warning to neighboring districts. We head to the state of Hidalgo just 150 kilometers from the capital, and we're in an Otomi indigenous area. Here, security is keeping outsiders at bay.
Imagínate, vengo desde las 5 de la mañana.
Las órdenes que tenemos son bien estrictas, el que no nos compruebe con credencial de que vive de este lado no se le puede dar la...
Si pido que me mande el acta de nacimiento.
There are no exceptions for outsiders. The village has already turned away more than 5,000 cars.
Espero que me dé permiso porque ahora sí que voy de visita con mi abuela. Si se dan cuenta, pues ahora sí que estoy bien. No tengo síntomas, nada de eso.
So far, Tenango has had no cases of COVID. The local mayor wants to keep it that way by maintaining safety protocols.
Muchas en comunidades no tienen acceso a medios de comunicación, muchas en comunidades no tienen internet y es complicado que ellos puedan tomar las medidas. Existe la incredulidad de muchas personas. Quieren seguir jugando fútbol, quieren estar en las misas, quieren ir a los tianguis, todo normal. No hemos tenido todavía esta aceptación de que esto es una realidad.
His measures are radical, but he believes they're safer and quicker than trying to change people's habits. But they come at a price. For generations, Tenango has survived on the income brought in by tourists from the capital, buying its famous handicrafts.
El bordado es la esencia fundamental del municipio.
This shop normally employs 600 weavers.
Independientemente que no ha habido entrada de dinero por el mismo turista, las personas a las que les damos trabajo, pues se les ha cancelado completamente. Tal vez estemos así un tiempo a que, no sé, salgamos afectados en cuanto a salud y esto sea peor.
Tenango has been cut off from the world for a month now. The government has called on mayors not to block roads or limit access, but more than 300 towns are implementing their own voluntary isolation as they wait for the country to reach the peak of the epidemic.
That wraps up this special edition of Inside the Americas. For now, stay home, stay safe, and stay tuned to France 24.
Your needs are changing, and so is France24.com. With articles, reports, the latest international news, all our programmes available on replay, together with live broadcasting 24/7. Intuitive, fast, and available in 4 languages. France24.com. Liberté, égalité, actualité.